Hello, I'm Angela Bosson. I work with the patient care team at Core Clinics. Today I just wanted to talk to you about a question we often get asked when people initially phone the clinics, which is which type of therapy is the best for me and my back pain. It's a bit of a tricky question because the type of therapy or therapies that's best for you very much depends on why you have the back pain you have, what the underlying causes are. I'll just spend a little bit of time talking about some of the different therapies we have and how we combine them in our treatment protocols to get the best results for our patients. So the first type of treatment that people tend to seek out for back pain is things like massage therapy, acupuncture, or they may be suggested exercises by their GP. Now these are all really good therapies when you initially have back pain, maybe if you haven't had it before, and if it's not there all the time and sort of affecting your day-to-day life too much. Massage, acupuncture, applying heat therapy, and gentle exercise and movement can all relieve the symptoms and potentially stop an initial bout of back pain getting worse. Whilst they're all fantastic in those situations, if your back pain doesn't respond or doesn't go away from those treatments, or you have been suffering for back pain which is more severe or for a longer time, it's unlikely that those therapies and those types of approaches in themselves will resolve the problem for you, because they're more aimed at pain relief and just getting you moving again, which is one of the best things you can do for acute back pain. So if you have a longer term problem, then as well as using whether it's home care or therapist treatments to help with pain management, we actually need to look at why that back pain is there and why it's not kind of resolving or why it keeps coming back. That is a much bigger variety of problems, and the only way really to know which apply to you is to have an assessment with an appropriate expert. So people like chiropractors, osteopaths, even podiatrists who actually specialise in feet and lower limbs, but they can have a big effect on back pain, believe it or not. They will look at you from kind of top to toe to understand how the way you sit, move, your posture, and things that you do habitually might be contributing to the back pain. But indeed other things like your diet, your stress levels, or actually problems that you've had through your development in terms of the way your bones have developed can actually create a kind of an underlying problem which is going to be difficult for you to resolve without some help to make some structural changes. So treatments like chiropractic, osteopathy, the type of mobilisation techniques that physiotherapists and sports therapists and people like that can do can be really helpful to nudge some of those underlying changes along, and you can use them in combination with massage therapy, exercise and acupuncture to help manage any kind of pain or tension that you have whilst we're trying to make those changes. However, if you just rely on the treatments that you have maybe once a week, once a fortnight in the clinic, but you don't make any changes to the sort of habitual way that you sit or move, by doing exercise, by improving your core strength and your posture, then there's a limit to how much of an improvement you'll get. It's basically like only eating healthily one day a week when you go for your weigh-in session, and eating whatever you want the rest of the time and expecting your weight to go in the direction you want. So in addition to the kind of massage therapies and the chiropractic, we also work with our patients to help them improve their posture, their core strength and the way they move, so that there's a kind of long-term underlying improvement. So we have people who, we have movement coaches, we have sports therapists and experts in strength and conditioning, and they can all do sessions with you and also give you home exercises that will change the way you walk, the way that you move, the way that you hold yourself, so to actually create a long-term change in your muscular patterns and your movement patterns. So all of those things in combination, we have tested across hundreds and hundreds of patients to find the best combinations of treatments and the best order that work depending on how long-standing your back pain problem is and what the causes are. There can even be all kinds of what seem like weird and wonderful additional things that people are often not aware of. Problems with your feet, arch problems, problems can carry from your lower body and come across as back pain, and indeed tension that you carry in your jaw and your head, and the way that you your dental work comes together can actually cause problems as well. But they are things which would be very difficult for you to self-assess, but we do have experts in our team who can look at those things and can either treat you within the clinic or refer you to people that we know are really expert in these areas. So to answer the question, what's the right type of therapy for my back pain, we first have to answer the question of what type of back pain you have and what's causing it. The best way to go on a path that is going to be the most cost-effective, time-effective, and get the right balance between making lasting change whilst having short-term pain relief is really to book an initial assessment with one of our chiropractors or sports therapists. Our admin team will be able to have an initial conversation with you to understand your symptoms and your history and put you hopefully with the right initial person. But all of our therapists also understand the expertise of people around them, so they can refer you to other people in addition or instead of themselves. So I hope that's been helpful. If there's any other questions in this area that you'd like us to do a video about, please post it on Facebook or get in touch with us and we'll get one of our clinical team to do an update. Thank you.